Do viral and bacterial ear infections affect hearing differently? Imagine your ears as tiny, delicate sound machines. When they get infected, it can change how well they work. But not all infections are the same, and they can affect your hearing in different ways. Let's explore how viral and bacterial ear infections impact hearing and what that means for you. Viral ear infections often involve inflammation inside the ear structures. This inflammation can affect the inner ear or the auditory nerve, leading to what is called sensorineural hearing loss. This type of hearing loss happens when the cells in the inner ear or the nerve pathways are damaged. Viruses like the ones causing cold sores or certain respiratory infections can directly harm these inner ear parts or trigger inflammation that does. Sometimes this hearing loss can be temporary, and your hearing might return on its own or with treatment. But in some cases, especially if the virus causes significant damage, the loss can be permanent. Viral infections tend to involve inner ear damage or nerve inflammation, which makes their effect on hearing more about nerve or inner ear health. On the other hand, bacterial ear infections, especially those in the middle ear, usually cause what is called conductive hearing loss. This happens because bacteria lead to fluid buildup behind the eardrum, often called pus or infected fluid. This fluid physically blocks sound from traveling properly through the middle ear. Think of it like a sponge soaking up water. When the middle ear is filled with fluid, sound vibrations can't pass freely. This type of hearing loss is usually temporary because once the infection clears and the fluid drains, hearing often improves. However, if bacterial infections happen repeatedly or become severe, they can damage the eardrum or the tiny bones in the middle ear called ossicles. Damage to these structures can cause permanent conductive hearing loss. Bacterial infections often come with more sudden symptoms like fever and pain, and they respond well to antibiotics, which help clear the infection and restore hearing. So, in simple terms, viral ear infections tend to cause damage inside the ear that affects the nerve pathways, leading to sensorineural hearing loss. Bacterial infections usually cause fluid buildup that blocks sound, leading to conductive hearing loss. Both can cause temporary hearing issues, but repeated or severe bacterial infections are more likely to cause lasting damage. If you suspect an ear infection, it's very important to see a healthcare professional promptly. They can diagnose the type of infection and recommend the right treatment to protect your hearing. Remember, every ear infection is different, and individual factors like age, overall health, and how quickly treatment is started can influence outcomes. Always seek personalized medical advice to ensure the best care for your ears.